Ẹ̀yin tèmi, ẹ tún káàbọ̀ sórí ètò ìlera Shulamite Cascade, where knowledge flows like fresh palm wine, rich, sweet, and refreshing. I am Fashiba Iyewumi Shulamite, the Nurse-invictus, and today I'll be talking about a topic that makes people feel pain while urinating, or having this I must pee every 5 minutes feeling, which is called UTI, that is, urinary tract infections. So what is this UTI? Let's dive in. A urinary tract infection happens when bacteria enter into the urinary system. And the urinary system consists of the kidneys, the ureter, the bladder, and the urethra. The kidney is where the urine is formed and being transferred to the ureter. The ureter can be likened to two long pipes that carry already filtered urine from the kidney to the bladder, which is a temporary storage. And from there, the urethra carries the urine to the outside body when the individual feels the urge to do so. Bacteria enter the urinary system, usually through the urethra, and start causing trouble. Women are more prone to UTIs because their urethra is shorter. Signs and symptoms of UTI. How do you know that it is a UTI and not village people? Look out for frequent urge to urinate with a few drops coming out. Cloudy, strong smelling or bloody urine. When your urine starts smelling like spoiled beans, something is off. Pelvic pain or pressure, especially at the lower belly. Fever or chills if the infection has spread to the kidney. Now let's talk about why UTIs happen. These are the common causes. Wiping the wrong way. Don't wipe from the back to the front, but wipe from the front to the back, especially for women with shorter urethra. After defecation, wiping from the anus to the front is like introducing bacteria from the backyard to the front yard, and that can allow E. coli to enter from the urethra upward, causing UTI. Please, E. coli no dey joke. Take note. Another causes include holding urine for too long. That habit of let me quickly finish this movie before I go pee. It can allow the bacteria in the bladder to multiply quickly and lead to UTI. Muscle, not drinking enough water. If you are not taking enough water, it can increase your risk of UTI. That is why water should be your best friend. What about sexual activity? Yes, sexual intercourse can push bacteria into your urethra, and that is why you should pee after intercourse. Using harsh soaps and vaginal douching. Like I mentioned in one of my videos, your V is self-cleaning. Don't use soap or vaginal douching. And lastly, wearing tight non-breathable underwear. Tight nylon panties traps moisture, and this creates an avenue for bacteria to grow, which can also lead to UTI. How do you prevent urinary tract infection? We all know prevention is better, safer, and cheaper than cure. Follow these tips. Drink plenty of water. Aim for at least 2 to 3 liters per day. Pee when you need. Don't hold your urine no matter how interesting the gist is. Always pee after intercourse to flush out the bacteria before they settle in. Wear breathable underwear. Cotton is your friend. Avoid tight, sweaty materials. Avoid scented soap and douching. Taking cranberry juice, although this is not a cure, but studies have shown that taking cranberry juice helps to prevent the bacteria from sticking to the wall of the bladder. If you've gotten UTI already, how do you manage it? UTI need to be tested to be treated properly. So, don't manage it in the house. Rush to the hospital. Antibiotics can be used to manage it. So the best way to manage UTI is using prescribed medications. Don't go and be using Agbo or taking herbal concussion or going to one chemist to collect any antibiotics you think. It needs to be prescribed after it has been tested. That is the best way to go. And also the use of pain reliever. If the body pain is too much, then over-the-counter medication like paracetamol can help. And drink water like your life depends on it, because the more you flush, the better. If you notice fever, nausea, or back pain, it could be that the infection has spread to the kidneys. So don't walk, but run to the hospital as soon as possible. So, ẹ̀yin tèmi, don't suffer in silence. UTIs are common, treatable, and preventable. If you've learned something new today, don't forget to share this to your friends, sisters, mothers, and even the men in your life, because men can get UTIs too. So tell me, what is the most funniest and ridiculous home remedy that is being used to manage UTI? Some people say putting sugar inside the vagina works, and this is a big lie. Share yours in the comment section. I would love to read from you. Till we meet again, stay informed, stay healthy, and stay winning. Ó dàbọ̀.